Hello and welcome to another episode of Pakistonomy. My name is Uzair Yunus, and the last few weeks we've talked a lot about policy, Modi's trip, role of elites in Pakistan, but haven't done a conversation on startups and what's going on. So the next couple of weeks, I think, are going to be about startups. We have an episode coming up the week after on sort of the state of the broader startup ecosystem, which we've covered at length on this podcast. But today, is a conversation about a startup that is about healthcare. And it's a topic that, I'm familiar with. Both my siblings are doctors, and I've had the experience of having many friends call up and say, KR, can you ask your siblings for the specialist in Karachi on X, Y, or Z, or what do they think about this doctor and that? And that information asymmetry, the concern many people, especially those outside Pakistan, have on healthcare and access to quality healthcare is a big thing, especially when it's related to your parents or your loved ones who are a bit older and need the right type of guidance and primary care and specialist care as well. So today we're going to be talking about a startup that I came across recently, Human Healthcare. It's a fantastic platform that is growing, and we're going to be talking to Dr. Atif Zafar about it. Dr. Zafar is a physician leader originally from Karachi. He's been trained in the US, including at the Cleveland Clinic, and is currently working as the chief of the stroke program at a major university hospital in Toronto, and also is a faculty where he teaches students, residents, and fellows at the University of Toronto. He's got experience building clinical programs in the US and Canada, and he's one of the founders of Human Healthcare, which has been launched in Karachi to allow overseas Pakistanis in particular who want family experience VIP healthcare for their loved ones under the supervision of foreign doctors, including those from the US, UK, and Canada. I think the market is broader than just overseas Pakistanis, so we'll talk to Dr. Zafar about that as well. But first of all, Dr. Atif, welcome to Pakistonomy, and thank you for taking out the time today.
Thank you, Uzair. It's a pleasure being here.
So I want to begin by getting sort of your own thinking and your team's thinking about human healthcare, right? It's a problem. When I first heard about it, I was like, wow, this is basically a huge need. It's a need that many of us engage and know about, or have friends and loved ones who have that need, in particular in Pakistan, where the information asymmetry, as I said, is significant. But tell us a bit about how and why you and your team came up with this idea, and what was the driving force behind founding Human Healthcare?
Sure. So Uzair, I think you would connect with this story. It is something that a lot of overseas Pakistanis experience. And you're right that our goal is that as soon as we kind of make our mark in this domain, or we want to make an impact in the country, in the healthcare system in Pakistan. So that's where the big vision is, that we want to make an impact, kind of pay back to Pakistan in whatever way we can. So the idea came about is. Obviously I'll share my story because that's how I started poking and asking other people, hey, do you want to do something like this together? So it came up where I came to the US. I've been in the US and Canada for about 12, 13 years now. And so when I came in at that time, interestingly enough, got the residency, a competitive match process in the US after graduating in Pakistan. But then at the time when the visas were being given, at that time there was the CIA ISI kind of a fight going on or something, where a lot of us Pakistani doctors who were matched and who wanted to go and start their training had their visas refused. So we were about 70, 80, doctors from Pakistan, Aga Khan, King Edward, Daw, predominantly, where we were all shocked. Everything was going well, and then this happened. But thanks to, a lot of our alumni, Apna, Dogana, these Pakistani organizations in the US really stepped up. A lot of people in Pakistan helped us. And more than half of us were then able to kind of, get the visa eventually. So that's kind of, I wanted to give that background, because when I went to the US, the idea was, okay, now you have come here, try to stick in and get all the training done that you want to. And while I was in my first year of training, at the end of it is when my mom ended up getting really sick. So she had some urine infections happening now and then, and this time it was pretty severe. Ended up getting admitted to the premier hospital in Karachi, but. And then there was this question whether she had a cancer kind of getting, developing in her belly and things like that. So obviously I was in this fiasco where what to do, continue to build my career, go back to my mom who mattered the most, to me. A lot of my friends were there, fortunately, getting their training at Aga Khan and other hospitals. So they were kind of jumped in and tried to help me out. So now here I am. I was at a point where I was like, okay, I spoke with my team, spoke with the Apna leadership that I had made connections with. They advised, hey, if you can stay, that would be great. It would be hard for you to, you apply for the visa again, no guarantees. But I was like, okay, I will take the risk because this is more important. Family is more important than my career. So pretty much all set to go back. But then some of my friends ended up reviewing her records and eventually found that 2 years ago when she had a screening scan done, this lesion that everybody was calling was a cancer was actually there in the same shape. So it was pretty much a benign lesion, which was kind of being discussed as it's a major cancer and it needs to be taken out right away and stuff. So now this whole serious excitement, dilemma kind of calmed down. And eventually she did get a surgery, but I didn't have to go back. Everything, happened in a calmer way. She recovered. And obviously I canceled, my flight back because my friends were like, we're here, don't take that risk. And obviously it was not a big deal anymore after the cancer diagnosis was out of the picture. So that was kind of really when I was like, what the, so everything, in medical, I know everything about medicine, could speak with the doctors directly. And this is what I was experiencing. So from, at that time, I had decided that, I want to do something where these type of experiences don't happen with me and with others. So started discussing with other people, other friends who had family back home. So we were building it up from that point. And we were waiting for our careers to settle down, have enough money that we can invest and do something like this. So that's kind of how it started. 10 years ago, the idea was there. We're waiting for the right time. And I was connecting with different people. Many people, said no. Many said we are interested, but they were busy. But we were able to get, 5 co-founders, smart people with different expertise, some had public health expertise, some, in Pakistan, actually going back to Pakistan because of their families. So we were able to create this idea into some execution form. So that's kind of where the story came in. And I'll tell you, one of our co-founders, who's our chief medical officer, Shoaib, he lives in England, a very smart guy. I was able to convince him after multiple discussions with him. And when he heard the story on what we are going to do and what the dynamics of this model would be, as a successful primary care doctor in England, he was like, Atif, I just cannot say no to this. So he jumped onto it. And that was the time when COVID had hit and his father ended up having COVID. So he had to shut down his clinic practice for 3-4 months or a couple of months to go back, leave his family in England and take care of his father as well. So I think it connected with him at that time. The way we wanted to do it, we connected with him as a medical expert. And then similar with the other co-founders, right? So it was the right time. The last part I would say is one of the things that was kind of turning me off initially launching it was because there was this entrepreneurial fire out there. Everybody, was doing something entrepreneurial. And I was, I personally am one of those people who feel like I don't want to do something that everybody's already doing. So I was holding myself back at that time. But last year when things started to go downhill, half of those exciting, startups started dissipating. And everybody had their hands off everything. And that's when I was like, okay, this is when I kind of like or enjoy doing things. And that's when I started to delve in and our group, launched this. So it's been a few months now, exciting time. And what we're doing is we're targeting overseas Pakistanis or Pakistanis living in Pakistan, but, executives or businessmen or professionals who are busy, but who want their family members to get world-class care. We're kind of targeting them. And we're making it equitable, where we're sharing some of the revenue that we get by offering services to the underserved people as well. So we want to create something equitable. So we're doing it that way. But right now, the first target is this group that we just talked about.
Well, that's interesting that your point on wanting to start in the midst of a downturn, or when the downturn began, makes you sound more like an investor than a doctor. So I think you have that inherent knack of the fact that some of the most amazing businesses are founded in economic downturns, right? That's when truly everyone shines who is capable of shining, when the tide goes out. And I think it's also the right time, in particular, in the sense that you get access to better technology talent and business talent in a downturn versus in an upturn when everybody was competing. I remember during the startup boom days that people would just change jobs every 3 months for double the salary, right? Because that's how the funding cycle was going. So it is a good time in that sense to go into this venture, particularly in healthcare. But look, as you know, and I have a sense of it as well, given my own siblings' experience, healthcare is very difficult in Pakistan. It's very difficult anywhere in the world, right? Because it's so personal. It affects people in sort of the closest way anything can, right? It's a matter of life or death for them or their loved ones. And in Pakistan in particular, the volatility of care, the quality of care, people have this view still to this day of doctors sort of, doing things that are not appropriate for the patient, or having that feeling, right? That lack of trust breeds into the system. So as you sort of been in this industry for a few months now, what are some things that you found have been easier than what you anticipated, and some that have been perhaps things you and your team did not think about that you're now having to grapple with in terms of building a business and really, providing excellent care to your customers?
Great question, Uzair. I think one of the things I'd say, obviously, I was reading a lot of books because none of us co-founders had a startup before, or we did have some business experiences from our family background, but none of us were really, into business. So we did a lot of exercising and brainstorming where what are the things that would, fail us within 1 year or within 2 years. And we've been in touch with Pakistan all along. Some of the co-founders are there and have active businesses, their family businesses running there, so they're in touch. So I think we were pretty wary of what to expect and things. But there's still, entrepreneurship or startup experiences always teaches you something new every day. So I would say this, that one of the things we thought would be easy, which didn't turn out to be, was still mind-boggling for me, was I thought that we're going to pay better and we're going to have top human resource available pretty easily, because that's one of the reasons why we wanted to start in Karachi, where the medical field is much more deep. But that's something that we were surprised about, that when we really got to the bottom of it. So, we had to screen for 200, 300 nursing candidates, to get to hire one of our team player.
Wow.
And similarly, dozens of doctors to get our one doctor. So we were interviewing 4 layers of interviews, and we wanted a lot of different things. We didn't want them to be too well ingrained in the Pakistani system, because then they would not really align with what we wanted to do. We are here to disrupt the system rather than be part of it. And then we didn't want somebody to be very, very fresh with no experience either. So we really had to pick great candidates. So, obviously the salary that we wanted to go up with, we wanted to go up with a good salary offer, but we had to double it up to get those smart people in, and things like that. So I think that we've been able to hire now. Obviously, it required a lot of extra work on our end, but where we are, we had to create a separate little mini business model that we're setting it up within our business. Is if we end up needing to grow like crazy, then how will we get that type of team? So that is kind of something that I was not really expecting in a country of 240 million with, a lot of people in the medical arena, nursing and doctors. So,
if I may
that's kind of one
interrupt,
area.
it's interesting you mentioned this because, when I talk to startup founders as well, on the technical side or even on the management side, right, that have nothing to do on the medical side of the equation as you do, it's the same thing I hear, which is that the quality people, a lot of people say and believe that, Pakistan mein talent bahut hai or quality talent is available. But a lot of people say, particularly at that spectrum of like, you need a bit of experience, like middle management level, good interpersonal skills, but also technical skills. It's what you're saying is consistent in terms of what I've also heard from people is that it's not as easy as people think it is to find good talent and retain that good talent as well in Pakistan.
Yeah, you're right, and I think the way I meant to say this is because from IT technology arena, we did hear it, so we knew that that's an issue, right? Compared to India, where Pakistan is, and what the technical depth is. But in healthcare, we at least in healthcare, it's a different concept. Like if I'm right now in Canada, I was in the U.S. It's the top 7 countries that provides the manpower or the labor force, right, to these first world countries, and it's Pakistan. That was probably creating some of the biases. You don't see that in technology or on the business side or even on the legal front that Pakistan is doing that. But in healthcare, Pakistan has traditionally done that. So that's why we were kind of complacent in a way, or going in with an easy mind. But still, I think it was extra hard work. But we were still able to get the people that we're really proud of, or the team that we've been able to build. The only fear is, obviously, when you need tons of people, at a rapid pace, how will you do that? So now we have a roadmap in place on how that rapid training and stuff would entail. So we weren't prepared while we were going in. And one of the things I would say that we were worried about more that did not seem to be, or we didn't experience it to be as bad or as tough, was really getting the startup registered and the early legal parts where I was like, Pakistan is a bureaucratic country, it would be much painful. Obviously, it was way more difficult than how I did it in the US or how you would do it in Canada, but still way better than what we had expected. So we were able to get a company with legal and all those, all that expertise who held our hand and then, got us through all the registration and all the startup, things where we had to do everything right and legal. So that was kind of a pleasant surprise that we were able to launch ourselves pretty quick than what we expected and get all that bureaucratic stuff done pretty quick, relatively speaking.
So you mentioned, and by the way, the SECP will love you for saying that. I think they've done that. This is again consistent with what I keep hearing as well, that the SECP has done a lot of really good things to, listen to the startup industry and make things relatively easier for them. And I think in a country where we often think of institutions and government as being an impediment, which is largely true, we must give credit where credit is due. And I think the SECP and the State Bank have done good stuff, especially for small businesses and startups in the country. One interesting thing you mentioned on the talent side as well, right, is you need doctors, which come out of Dow and Aga Khan, etc. But nurse practitioners, in my view, at least in the US, are increasingly important as well, right? And a lot of times when I have a little bit of a sickness, I will not bother waiting for an appointment with the doctor. I have comfort in the sense that I can go see at the practice the nurse practitioner, and he or she will give me enough of a good care to take care of that immediate need that I might have. Pakistan doesn't have a lot of skilling around nurse practitioners. So what's that ecosystem like? I know you mentioned 300, 400 candidates to recruit one. And how are you thinking about sort of building capabilities on that side as you think about scaling your business as well?
Yeah, great question. I think you were spot on when you talked about the nursing part and how different arena it is in the first world countries compared to the developing world. So that's kind of actually what the leverage we use, where when we were able to get good nurses through the interviews, they were getting good salary, and then there's opportunities available in the Middle East and elsewhere, or some of them, a lot of them actually can get easy immigration to Canada these days. So that's kind of the leverage we use. We have this program where we kind of get them a little bit more hands-on the clinical front. So we are selling ourselves as, you'll come in as a nurse, but we'll grow you more than just the bedside nursing that you do in the hospital, right? So we get them work with the doctors. They have this exposure to all these consultants and experts, practicing in the US, UK, and Canada. So it's kind of a while working training, internship and residency type of a thing. So they're paid, they're working, but at the same time, they're getting exposed to this top skill, which is going to groom them. And that's kind of the model we're trying to build, where we're going to make everybody work at the top end of their paycheck, which is going to kind of increase the productivity, where everything's heading. So that's kind of the leverage we have used to attract talent and keep talent. And it's not easy, because if they have opportunity coming in from the Middle East or Canada, and how can you kind of still keep them there in Pakistan, where everything is volatile? So far it's a very small team that we have, but we're paying better. We're keeping a very positive environment, and we're training them, and they look pretty good, and they're pretty happy. And the reward that we're getting, right? We haven't touched upon really why we started this. Were our families and our patients and our people, and that's what's delighting us, and what's delighting our team right now is the formula that we have created. That we're delivering as a one-stop shop, personalized care, where for the first time, hospitals and doctors are not the core of healthcare, but it's our families and our patients. And that concept is what I've learned, building programs in the US and Canada, is this unique ingredient that at least has helped me build my career here. So that's kind of what I'm implementing, and it's an amazing experience for our team in Pakistan as well, because when we hear the feedback, and as I told you, just before the interview, that none of our customers are leaving, right? Some of them who are going, one of them is actually going to Pindi, or moving to Pindi from Karachi, is like trying to figure out a way where we can move, launch ourselves pretty quick over there, which we're hoping that we'll do. But so that's kind of the other exciting arena, which is really what the juice of what we're doing is. But yeah, from the nursing standpoint, the nurse practitioner role is not there in Pakistan, and that is something maybe in not that form, because the nursing in Pakistan goes through the high school pathway rather than a college pathway. But maybe even as a CNS, a nurse specialist rather than a nurse practitioner, that's kind of the direction we're heading.
That's fascinating. And that brings me to the customer side or the patient side of this journey, right? I mean, look, if I think about my own experiences growing up in Pakistan, they're sort of the let's call it the life cycle of a patient, right? You're sick, or your parents are sick, or your grandparents are sick, or somebody's sick. It'll be like, acha, bukhar hai, you have a fever, let's take you to the local doctor. And a local doctor puts up a strip on your head, Panadol, you're done. Couple of days go by, you're not doing so well, you go to the same doctor, some tests are done, still not better, then you go immediately to the hospital, right? And that's your next jump up. So it's from the local physician all the way, immediately jump to the hospital. And a lot of times people, because they're not aware of how to think about their own healthcare, which, you shouldn't be, most people aren't, it's too late by the time you go to the hospital, and the complications set in, and the cost of care is very high. A lot of people pass away because of that missed opportunity of care at the early point. So I see the need for that one-stop shop that kind of gets the holistic way of providing care. So if somebody's listening and is like, okay, I want access to, how do you work? How do you serve your customers? And what does that customer journey or life cycle look like at Human Healthcare?
Yeah. So everything you described is exactly what most of us have all experienced. I would just add that layer where you said that you would go to a doctor and they will give you a pill, maybe it will work, the Tylenol or Panadol. Uh, uh, I remember the doctor that I used to go to, when I was a kid, he would give me a pill for malaria, a pill for typhoid, and I think a pill for antibiotic, for throat or other infections. So I think he was used to the fact that I want to give a pristine
You
service
you
with
you get a full cocktail.
yeah. So I didn't need to go to another doctor, but next time when I needed an antibiotic, it wouldn't work because I was getting exposed to all this. So you're right. That's kind of the practice based on, the doctors become pretty good at gauging on what the customer or the patient's like, and they can provide that type of service.
And if I
So the
may
experience,
interrupt you again
yeah,
before
yeah.
that, one thing I often still hear, right? And now that I think back on my own time in Pakistan, I chuckle over it. Is डॉक्टर हमेशा कहता है आजकल वायरल चल रहा है तो इस वाले वायरल की ये दवा है, and that's everyone in that room is getting that cocktail because that's what the doctor thinks is going on at this point in time.
Right, right. And I think that's a great point. And being a doctor and on the defense side of the doctor, what I would say is a lot of it is driven by data, right? And when you have no data, then that's how the practice would be. It would be anecdotal, it would be personal experience based. So those are the things that obviously, being in Pakistan, मैंने internship डॉ सिविल हॉस्पिटल में की थी, वहाँ पे बैठे हुए 1,000 लोग हैं, हम लोग देख रहे हैं मरीज को. तो we know how it works, और फिर खुद भी पेशेंट के तौर पे डॉक्टर्स के साथ, from street doctors जो कि clinics होती हैं to Aga Khan या major hospitals, you're right, it's exactly that way. And that's kind of where we have paid attention to, right? So we spent a lot of time with consultants in UX, before even we launched ourselves on what is UX, and so we had to do courses and learn as doctors, which none of us do before we launched it. So our experience is like this. So obviously we are a very early startup. We want to make sure that the customers who are unhappy with this current system, they're busy, they're professional, and they have the same kind of ideology like we have. They join us, and they can go on our website. It's human-healthcare.com. It has a WhatsApp messaging tool. They can get in touch with us, questions, anything they have. We've given FAQs in there, but they can get in touch, directly interact with us. We can answer all their questions on around our services. But the user experience is something like this. I'm a busy guy like Uzair, and I have my parents for example, in Karachi, and I feel like they're getting older. I want to stay on top of things. Mujhe nahi last minute flights kara ke jana. I want to be, I'm smart enough to know that's where we're heading towards. So I want to be ready for that. So you go on our website, you get in touch with us, or directly get your parents enrolled. Some basic information is needed. Within 48 to 72 hours, we coordinate with you, we coordinate with your family, and we set up an onboarding visit at the time that works for them. And then our onboarding team goes in there, and really the model, the way it works is we have a dedicated doctor and a dedicated nurse that would be dedicated to that specific family member. So Zair's parents will get a team of doctor and nurse who will go there in person to their home based on their convenience, and then use a lot of the concepts of psychology to make sure that we build rapport, and we are acting like how Uzair or Uzair's best buddy would act like when they're not a typical doctor. So we've kind of provided that Starbucks-like training. While they're interviewing or giving us all this information, we have these foot spas that we are having them feel relaxed. We're going in with some gifts so that they feel like it's a family member, कि Uzair के कोई friend आए. But these are doctors and nurses who are collecting data in our electronic medical record with some high-tech gadgets that no one else is using in Pakistan, that are proven, published, San Francisco or different cities में randomized control trials के through published. And so we have these devices where we're recording all these metrics within the system. So it's not old school anymore where a doctor ने सुना, फिर 500 लोगों का और सुना, फिर 3 महीने बाद दोबारा लंग को सुना तो क्या याद होगा. But we have this lung sound, these heart sounds recorded, on Google Cloud in a very patient secure, HIPAA compliant way, so that next time when our team comes in or patient ko koi lung issue hai, heart issue hai, we have this comparative analysis through technology to compare it. So वो पूरा experience होता है और हम patient को educate कर रहे होते हैं कि आंटी देखें ये अभी हम record कर रहे हैं या आपकी EKG आ रही है, eye picture, kidney patients में periorbital edema से हम आंखों के किनारे के सूजन से गेज करते हैं कि कैसा फंक्शन है, तो वो पिक्चर हम अपनी सेव कर लेते हैं. अगर कोई रैशेज हैं तो वो सेव कर लेते हैं. तो एक पूरा कॉम्प्रिहेंसिव विजिट होता है जिसमें पूरी डिटेल स्टोरी ली जाती है, जितनी दे सकें उस टाइम पे आंटी अंकल या पेशेंट्स, और फिर हम डेटा गैदर कर लेते हैं. बहुत सारी इंफॉर्मेशन हमने देखा कि एक दफा में नहीं दे पा रहे होते, तो अब हमने उनको डिवाइड किया हुआ है सब्सिक्वेंट विजिट्स के लिए. तो उस विजिट में हम रिपोर्ट बनाते हैं, रीअश्योर करते हैं, एजुकेट करते हैं, and then we have a lot of this data, and then we tell the family and we update Uzair, okay, we're going to evaluate all this information and data and create this plan that we're going to work with. There will be some urgent issues कि कोई skin rash है जिसका भी problem हो रहा है, एक हफ्ते से चल रहा है, तो हमारी टीम में सारे स्पेशलिस्ट हैं जो यूएस कनाडा इंग्लैंड में बैक एंड पे. तो डर्मेटोलॉजिस्ट हैं, राइट, कार्डियोलॉजिस्ट हैं, न्यूरोलॉजिस्ट हैं, रूमेटोलॉजिस्ट हैं, जेरियाट्रिशियन हैं, यू नेम इट, वी हैव देम, राइट. So they're part of our panel. They're all people who have families back home, so they're very passionate about what we're doing. So they have equity in the startup and they are interested in making it successful. तो उनको पिक्चर चली गई, उन्होंने हिस्ट्री पढ़ी इलेक्ट्रॉनिक मेडिकल रिकॉर्ड से, बोला भैया ये तो एक्जिमा है, मोस्ट लाइकली वो या तो गलत साबुन यूज कर रहे हैं या जो कर रहे हैं, वो मसला हल हो गया. सेम विद डिफरेंट इश्यूज, राइट. बहुत सारे पेशेंट्स को डायबिटीज एंड हाई ब्लड प्रेशर है, तो हमारे कार्डियोलॉजिस्ट, नेफ्रोलॉजिस्ट और एंडोक्रिनोलॉजिस्ट जो यूएस बेस्ड हैं वो ऑन बोर्ड हो जाएंगे विदाउट नीडिंग इवन एनी इन्फॉर्मेशन, राइट. दे हैव द इलेक्ट्रॉनिक मेडिकल रिकॉर्ड, दे हैव ऑल द प्राइमरी केयर इन्फॉर्मेशन फ्रॉम आवर ट्रेन डॉक्टर्स, जिनको पता है कि डायबिटिक स्पेशलिस्ट अपनी विजिट में कौन कौन सी चीजें पूछता है, तो वो चीजें वो हमारे EMR के थ्रू पूछ लेते हैं. So it's kind of this experience on the first visit where we give them this hands-on experience, give our information, tell them how we're going to be in touch, and then from there on, we're available. So, once a week touch points, once a month visits to get all their data from weights and stuff. इस पहली visit में हम comprehensive blood work भी कराते हैं जो पाकिस्तान में routine नहीं है. तो हमने आगा खान लैब के साथ deal की हुई है, तो we kind of, our nurse draws the blood, they're trained in blood drawing with one prick, they drop the blood back to आगा खान. अगले दिन से पहले पहले लैब रिजल्ट्स आ जाते हैं, वो आपने उजैर ने यहीं से बैठ के देख लिए, फैमिली को पता चल गया, हम लोग उसको असेस करके फिर एक पर्सनलाइज प्लान बनाते हैं विद इन अ वीक. अगेन क्योंकि हमें इनपुट चाहिए होता है यूएस कंसल्टेंट्स का, तो वो इनपुट का लेके एक प्लान बनाते हैं. और उसके बाद वी आर अवेलेबल, राइट, फ्रॉम लाइक अभी एक पेशेंट है, उनका ब्लड प्रेशर थोड़ा फ्लक्चुएट हो रहा था, her daughter is a very successful physician in the US, and she was like, अब मैं क्या करूं, कहाँ से लूं, पाकिस्तान में क्या होगा, राइट. तो ऐसे तो नॉर्मली एक डॉक्टर ने बोल दिया भाई ब्लड प्रेशर चेक करें, काम खत्म. अब वो उनका मसला है अमेरिका में, कैसे अपनी मदर का मसला हल करें. हमारी सर्विस में ये होगा कि हमने उनको 4-5 ऑप्शंस दिखाए, हमने बताया ये 2 अच्छे हैं, उन्होंने कहा हाँ आई एग्री ये 2 हैं. हमारी टीम गई, पिक किया, घर गई, ट्रेन किया, ट्रेनिंग में अपने गैजेट से कंपेयर किया, प्रूफ किया कि इट वर्क्स लाइक अ चार्म, और उनको दे दिया. अब हेजिटेंसी आ रही थी कि क्या चेक कर पाएंगी, मुश्किल होगा आंटी को खुद से करना. तो अब अभी विद इन द लास्ट 6 months एक नया गैजेट आया है जिसमें ऑटोमेटिकली ब्लड प्रेशर थ्रू अ रिस्ट डिवाइस FDA अप्रूव्ड है जो चेक हो सकता है. तो वी हैव काइंड ऑफ बॉट इट एज अ सैंपल, दीज आर एक्सपेंसिव गैजेट्स, बट वी आर ब्रिंगिंग इट इन, नेक्स्ट मंथ वो आ जाएगा. So then we'll be able to kind of make it even more comfortable for them. So these are just one thing, and then overall US Canada की guidelines होती हैं कि भाई मैमोग्राम होना चाहिए. पाकिस्तान में कोई कॉन्सेप्ट ही नहीं है, राइट, कि ब्रेस्ट कैंसर इतना कॉमन कैंसर है बट चेक ही नहीं हो रहा. तो वो हम करा रहे हैं, तो हमारे पेशेंट्स बहुत आराम से ऑन बोर्ड हैं, हम उनका मेमोग्राम करा लेते हैं. अब हमने एक थर्ड पार्टी से कर लिया है, वो घर पे भी आके टेस्टिंग हो जाती है. तो we've made it very convenient. कभी टेस्ट के लिए ले जाना हो तो हमारी गाड़ी आती है नर्स के साथ, वो लेके चली जाती है, टेस्ट करा लेती है, So it's kind of a one-stop shop, as I said. You get all the experience, all the expertise in a way that, obviously even as doctor, I would imagine कि यहाँ US Canada में भी किसी को मिल जाए, right? So that's kind of what we're providing to our families back home.
That's amazing. And I think just in terms of, as you were describing it, the electronic medical record struck to me in particular, because often hota hi hai कि you don't even have the full history with your parents or your loved ones. Even I would not have it. My friends don't unless you're very OCD about it, right? You want to keep that file, which then means that over your life, as you go through different specialists or different phases of your healthcare, you don't have the background data. And I think keeping that full record, as you described it, is extremely important. So I'm really glad your team is doing that. The follow-up question I had to this was, okay, you've onboarded my parents, they're in the system, the journey has started, you have the plan, and they're on consistent medical care, right, for diabetes or whatever their current conditions are. But let's say if there's something very major that happens for which special, let's say you do the mammogram and there's breast cancer. Now that is the next step, right? In terms of, okay, I need to find the right care, the right doctor, the right treatment plan, and the right oncologist. How do you deal with that sort of step change in a patient's journey that says, you know what, the standard preventative care or the model of the plan is not working anymore because something's changed with the patient? And how do you then help that patient go through that process?
Great question. And Uzair, to answer that question, हमारी टीम को जब ट्रेनिंग मिल रही होती है तो we say, what will you do if it was your mom, right? तो अब आप अगर डॉक्टर्स का कोई भी फोरम उठा लेना, व्हाट्सएप हो या फेसबुक हो, उस पे जो नंबर वन क्वेश्चन है ना, वो यही है जो यू स्टार्टेड ऑफ विद, यू नो, व्हेन यू वर ओपनिंग अप दिस सेशन. तो हम एग्जैक्टली इसी तरह करते हैं कि हमने मेमोग्राम पे डायग्नोज कर लिया, हमारे ऑन्कोलॉजिस्ट यूएस में भी हैं, you know, we showed them the report. They're like, yes, इसको तो resection करना होगा, कीमो होगी. तो then what we're building on the back end is हमने divide किया हुआ है, you know, ratings दी हुई हैं physicians को, you know, जो internally सारे physicians हमें पता होती हैं, भाई ये डॉक्टर अच्छे हैं, ये हॉस्पिटल इस प्रोसीजर के लिए अच्छा है. तो हमारा एक बहुत बड़ा एक डेटाबेस है जो obviously as we are growing वो build up हो रहा है. और जो हमारी अभी नेक्स्ट ऐप सेकंड वर्जन लॉन्च होने वाली है, उसमें हम लोग we'll make it free for even general public to have access to it, even if they don't want to or they can't afford to be in part of our program.
Which is, by the way, the moment you make it public, it's going to be a huge public service, because any given week I get at least a few messages saying from friends, okay, here's 3 names. Can you ask your siblings, do they know them? Do they know somebody else for this particular ailment that they're looking to solve for? So people don't have that information, and it's a big gap.
True, you're absolutely right, and they can get it. I think it's their right to know कि क्या हम लोग सोच रहे हैं और हम लोग किसके पास लेके जाएंगे. तो you know, it's kind of open thing. It's our own opinion as a startup, so we'll share that with people. It would start kind of, you know, यहाँ कैसे US Health News की एक ranking और best doctors और ये वाली चीज होती है, उस तरीके का एक concept, you know, एक healthy competition इसकी वजह से अगर launch हो गया तो it doesn't hurt. But really, we go a step ahead, right? What we do is what I would do for my parents. तो मैं जब AKU में या साउथ सिटी में या you know कोई शौकत खाना मिले जा रहा है, तो कहीं कुछ होता है और वो ओपिनियन मिलती है, तो मैं रिपोर्ट्स मंगवाऊंगा अपने भाई से, या you know बोलूंगा अबू जरा रिपोर्ट्स भेजें, and I'll get it checked with my colleagues here, right? So that's what we will be doing, even though we'll be further apart. कोई सर्जन हमारा वहाँ पे हमारे स्टार्टअप का नहीं है, but that's kind of how we'll manage. We'll guide the family, कौन अच्छा है कौन नहीं है. This is trustable person. हम अपनी फैमिली का भी उनसे कराएंगे. हमने ऑन्कोलॉजिस्ट से हमारे कंसल्टेंट ने रिव्यू कर लिया है. द प्लान साउंड्स गुड. या अभी जैसे केस हुआ था कि you know ये कीमो अच्छी है, बट इससे अच्छी भी एक कीमो आ गई है, वो बाहर से मंगवानी पड़ेगी if you can afford it, but if not, this is fine as well. You know, इस तरह का input which is kind of cutting edge, state of the art, वो families को at least available हो जाता है, and then we pragmatically उनके साथ मिलके next steps पे काम करते हैं. और इवन जब हेल्थ रिकॉर्ड वहाँ का डेवलप हो रहा होता है, फॉर एग्जांपल लोकल हॉस्पिटल में कहीं गए, वहाँ उनका हुआ, तो फिर हमारी टीम फैमिली की हेल्प करके उनसे फोन पे और फैक्स पे या जाके पिक कर लेती है उनका रिकॉर्ड, ताकि वो 2 लाइनें ही लिखते हैं पाकिस्तान में तो, यू नो, हैंड राइटिंग से, लेकिन एटलीस्ट हम लोग उसको एक जगह कंपाइल करते हैं टू काइंड ऑफ मेक श्योर कि उज़ैर जब देख रहा हो तो उसको खुद मेहनत नहीं करनी पड़ेगी, भाई उन्होंने क्या बोला. तो व्हेन यू आर पेइंग दिस मंथली सब्सक्रिप्शन मॉडल, यू आर गेटिंग द कन्वीनियंस इन रिटर्न. तो इस तरीके से we stay together, you know, in the journey. And now, because some of our clients had this need, we're adding extra, you know, layers. These are small steps, you know, as the startup stake that move us forward. For example, knee surgery हुई है, you know, 2-3 clients के parents की, तो वो कह रहे हैं भाई 2-3 महीने के लिए मैं तो दुबई से या कनाडा से नहीं जा सकता, तो कैन यू अरेंज समबडी? सो नाउ वी आर ऑफरिंग दोज सर्विसेज एज वेल, वेयर 3 महीने के लिए हम नर्स एड्स रख देंगे, मील्स ऑन व्हील की अरेंजमेंट कर दी है, जहां हम लोग डाइटेशन सुपरवाइज्ड meals prepare करवा रहे हैं, so that we can provide healthy services outside that. Because as physicians we have realized that until we are going to extend our hands and tentacles into the public realm of things, which so far we've always been out of, right? बोला भाई ब्लड प्रेशर चेक करो और घर चले गए, क्यों नहीं हो रहा चेक, क्यों नहीं हो रहा, क्या मसले थे, नहीं हो रहा. That's what our startup is doing. That's why we're calling ourselves human, right? Human dash healthcare is we want to get connected with the humans and solve that problem. So yes, we're not only going to guide who the good doctors are. We're not like recently abhi hamare patient who had an issue and had to be hospitalized. So I ended up calling and the hospital and telling them I'm taking care of them and I want to know. तो उससे एक उनको और भी एक vibe hospital को हो गई, तो they were all staying on top of things. तो we kind of do it that way. हमारी टीम जा जाके उस hospital में फिर during his stay visit कर रही थी, and it just makes the hospital kind of step up their game as well, because they know there's somebody's watching. So that's kind of the extra thing, that even in areas where we are not providing the primary service and we're relying on these third-party hospital services, which we have to, that's kind of the extra layer of value we are adding in our clients.
That's fascinating. And I think this is a huge need in the market, especially as you said, getting into the other elements, right? Like you have diabetes, but agar ghar mein khana sahi nahi ban raha and you can offer a meal plan, then that's value add, and that's immensely powerful because it reduces the burden of the medicine as well over time, which is has its own benefits as well. Last question, you said you're launching a new version of the app. You have a patient going to Pindi, wants you to expand there. What's next? What's the roadmap for growth? What are you looking to do in, let's say, the next 6 to 12 months?
Yeah, so where we are is we're growing, right? So we are launching our second version of electronic medical records as well, which has this machine learning AI algorithm, because we're the big vision is that can we be the first one to create the true language models that are physician driven rather than so back end based specialists or doctors ki jo communication ho rahi hai. So that EMR is going to be transformative in that. So we're kind of very tech enabled. So that's kind of नए gadgets जितने आ रहे हैं, FDA approved हैं, different companies से US Canada में बात कर रहे हैं कि can we introduce this, can we introduce that. So we're very excited for the next 6 months, क्योंकि उनमें से 2-3 चीजें हम अभी introduce कराएंगे within our clients. एक तो ये, दूसरा ये कि either by the end of the year or early next year, we want to go to the other big cities. So that was one of our milestones that we wanted to achieve. So Lahore and Islamabad, Pindi are our next cities that we want to go into. And then the other part is that initially we started off with a doctor nurse team, and now we just hired a part-time, machine learning kind of expert. So we are kind of already working on that end, automating a lot of the things as they become safe and secure. So those are the kind of the big areas. And the last one I would say is we're going to launch our kind of a partnership where we'll allow people to come in and experience an in-person visit as well, because that was one of the things that we were hearing, that people want to go in a shopping mall और फिर रुक के उन्होंने अपना एक concierge style एक checkup भी करा लिया. So we're kind of opening it up in DHA.
I'm thinking one medical experience here in the
You're
US,
absolutely
kind of
right.
like.
Yeah, Carbon Health, one medical type of. तो वो अब हम एक launch करने वाले हैं within the next 6 months. So little steps, little tiny things that we're doing that and then we'll get feedback from our clients and see what they like and what they don't, and then pivot and then grow from there.
Yeah, the one medical thing, I think I would do it sooner rather than later if I were you, because from my own experience here in Washington, D.C., the first time I was able to go to a one medical concierge service, because through our insurance, there was a pilot program, and I was like, okay, let's check it out. It was the first time I actually felt happy being in a doctor's office, right? Because the experience was good, kind of got a good sense of care, and the environment was better. Otherwise, you're always like, yaar, pata nahi कहाँ आ गया हूँ डॉक्टर की ऑफिस में, right? No
That's
offense
true.
meant. I know you're a doctor as well, but One Medical really changed that idea of that people had of what it meant going into the doctor's office. But again, Dr. Zafar, this is exciting stuff, and thanks for sharing your own journey, your own thinking at the personal level about how this came about and what you're looking to do, because I think it's a huge gap in the market in Pakistan. Is both a great business opportunity, but more importantly, a positive impact on people's lives. Before I let you go, I always ask my guests, what are two books you would recommend to the audience?
Yeah, great question. I've been reading a lot of books lately, and a lot of them to educate myself on the education front. Uh, I would say the one that has impacted me the most, that I keep on giving to my friends and my recently I gave it to my brother, is Nicholas Taleb's Anti-Fragile. I think it's I feel like हम पाकिस्तानियों के अंदर एक इमोशनल, एक इंटरेस्टिंग एस्पेक्ट होता है जो मैंने बहुत अपने फैमिली में, कजन्स में, डिफरेंट लोगों में देखा है. इमोशन ड्रिवन हो जाते हैं, the way we are kind of brought up. So that book Anti-Fragile is kind of adds this layer in a scientific way. It explains to you on how human psychology and human feelings work, and why failure is not a dangerous thing. That book has been an inspiration for me, and I recommend that to everybody. The other book, I think I would say two more. One is Persuasion by Cialdini. It's about how to be a good leader and how to be a good influencer amongst people around you, and things like that. So it's a very self growth book that impacted me quite a bit, and I share it with my mentees and friends. One book that I'm reading right now, actually, it's on my desk. It's called The Evolution of Cooperation. And it's a very different book by Robert Axelrod, and I'm halfway in there, and it's all about cooperation and interaction and engagement, and दोस्त के साथ कितना करना है, कितना नहीं करना relationship में. I'm touching 40 this year, so maybe I'm going through a middle age crisis and stuff, but this book is kind of giving me an idea on how to balance life, relationship, and business. So I think I'm already halfway in there, and I feel like this would become one of my favorite books as well. So these three, I would say.
Well, I would say, I think as the old saying goes, 40 साल में अकल आने लगती है इंसान को थोड़ी ज्यादा. So I would say it's not about the crisis, it's you get wiser, is how
Yeah.
I'm 35, so maybe that's how I think approaching 40. That's how I keep going, I guess, getting older. But Dr. Zafar, thank you for those recommendations, and thank you for taking out the time. For those listening in, do check out human-healthcare.com. And again, would love to see you grow and enter new cities and disrupt the healthcare market in Pakistan, and wish you and your team all the best. Thank you.
Thank you so much, Azhar. Thank you. Have a good